Barberton Citizens Hospital has been undergoing major expansion. The hospital now provides great depth and diversity in specialized services. And that's great news if you're a heart patient, especially in the southern Summit County area.
As recently as a few years ago, most patients needed to travel to Akron or Canton to get the services they needed for catheterization or coronary artery bypass surgery. The holy grail, if you will, in healthcare is that most patients want services provided to them in their own community.
David Stevens is Administrative Director of Cardiovascular Services at Barberton Citizens Hospital.
Barberton Citizens Hospital has invested over $12 million to develop a comprehensive cardiovascular services program. We cover everything from A to Z in cardiac services.
Back in 2004, Dr. Robert Debsky was recruited to head the hospital's new cardiac surgery program.
I could see a level of commitment from the administration and the hospital staff to expand the level of care of this hospital, particularly from the cardiovascular standpoint. Over the past 3 years, I've seen tremendous changes and support from all involved. I think that we've accomplished a very successful program in less than 3 years.
During that time, Dr. Debsky and his staff have taken a new technology to an even higher level. It's called endoscopic vein harvesting, and it's for people having coronary bypass surgery. In such operations, a good vein is taken from the leg and then used in the chest to reroute blood to the heart.
We used to make incisions up and down the legs, and patients would typically complain after their surgery that the problem would be more with the legs than with the incision in their chest. Diabetic patients in particular would have a difficult time healing their leg incisions.
But with endoscopic vein harvesting, a small incision near the knee is all that's needed. Registered nurse First Assistant Adam Everhart describes the process.
As I'm running the endoscope down the saphenous vein, I'm identifying all the side branches that lead to the saphenous vein. When I get to the point where I feel that I have enough vein for Dr. Debsky's grafts, I then use the scope and I cauterize or burn the side branches, then cut them, which frees up the vessel itself. I then cut the very end of the saphenous vein after it is tied off and clipped, and then I pull the saphenous vein out through that same incision. With this, just a small incision, and it's just so much less manipulation of tissue that the pain is reduced by at least half, if not more.
Patients undergoing endoscopic vein harvesting have up to 75% fewer complications, and diabetic and obese patients have an 80% lower chance of infection. Barbara Horvath had the procedure done just before Christmas.
It really didn't bother me all that much. It was just an irritation, but there wasn't a lot of pain with it.
When we were starting this program back in 2004, we had looked at the options of how we were going to harvest vein, and we came to the conclusion that the endoscopic vein harvesting was absolutely the way to go. So we decided that we were going to lead the way in this area and make it a standard of care for all of our patients.
When we implemented our program a couple years ago, we had a saying, "We've got the beat," which means we now have the services that you come to expect. Today we have a saying, "The beat goes on," which means we are dedicated to keeping Barberton Citizens Hospital at the forefront of cardiac services.